Welcome everybody. We are Las Cruces High School HOSA. This is Mia Williams, Cooper Carroll, and I am Maite Reese, and we will be presenting to you how to normalize mental health.
We chose this topic because we want to educate teenagers, which are our target audience, about how common mental illness is and coping strategies to deal with mental health whenever they're having a stressful mental health day.
So, what is mental health? Mental health refers to the emotional, mental, and social well-being of every individual. And everyone has a mental health, and it isn't a one-size-fits-all issue. It can vary between the trauma that you experienced or the level of severity, and just realize that you aren't alone in this journey. What causes mental illness? There's numerous factors, but trauma is the majority, and this can include childhood experiences, abuse in previous relationships, severe medical issues, use of alcohol or drugs, having feelings of loneliness, and also heredity/biological factors.
Understanding mental illness. Mental health, everyone has it. It affects every aspect of your life, from mental to physical to social and even spiritual. If you have a good mental health day, maybe you did well in class, you did well on a test, maybe you enjoyed spending time with your friends, or you did great in your sport. If you had a bad mental health, maybe you forgot about some assignments and you turned them in late and that cut your grade, or your mom woke you up yelling at you to get up and that affected you throughout the rest of the day. That happens, and it changes how you act for the rest of the day. That is your mental health. And mental illness is a low mental health consistently throughout a long period of time. It affects every aspect of their life and even stops them from being able to do simple things like even get out of bed in the morning. That's why it's important to understand the effects that mental health and mental illnesses can have on your body and your soul, mind, and every aspect of your life in order to keep track of it and stay healthy. Actually, here's a graph that represents the mental disorders through kids from as little as 3 to 17 years old. As you can see, purple represents behavioral disorders, orange represents anxiety, and blue represents depression. From ages 3 to 5, behavioral disorders are higher. That might just be because they're starting to feel more complex emotions and they're getting used to that. That's normal, it's developmental. In elementary school, age 6 to 11, behavioral and anxiety goes up. They're starting to get into school. Maybe they're stressed about their friends, their family. They're able to realize that more. And then in high school, everything gets worse. They get more stressed. They have high hormone levels. Especially anxiety and depression increases a lot from previously, as you can see. That can be due to a lot of different factors for a lot of different people, but it's no surprise that it's high among teens specifically. In fact, 1 in 5 teenagers have or have had a seriously debilitating mental disorder at one point in their life. Some still have it. Some are dealing with it currently. Some have dealt with it and maybe are doing better. But that's an insane amount of people. That's almost 20%. And it's surprising and shocking how frequent and powerful this problem is in today's society, especially among teenagers.
Friends and family. One of the biggest things about mental health is being able to express how you feel. As Mia said earlier in the presentation, one of the biggest factors is family trauma. I personally come from a first-hand experience of my family not believing in mental health. So as long as you find somebody to confide in and somebody that you feel safe and trust to talk about how you feel and what's going on in your mental health and the mental illness that you're going through, that is fine. You can talk with anybody you feel trusted. It could be a friend, it could be a teacher, an advisor, your coach even, whenever you're playing a sport. As long as you talk to somebody or express one way or another, that is very good for your mental health. A breathing exercise that we're gonna do. Breathing exercises are known to reduce your stress hormone in blood and also to give you a sense of calm and well-being. So I'm going to present how to do one of the exercises called the 4-3-4 method. Mia and Cooper are going to help me. They're going to be my subjects. So we're going to breathe in for 4 seconds through our nose. We're going to hold for 3 seconds, and we're going to breathe out through our mouth for 4 seconds. Okay? So we'll go on, go? Mm-hmm. Okay. 3, 2, 1, go. So breathe in. 1, 2, 3, 4. We're going to hold for 3. 1, 2, 3. And we'll breathe out through our mouth. 1, 2, 3, 4. Okay? And you can keep doing this over and over and over until you feel calm within yourself. It doesn't happen the first try. You have to keep doing it, and you have to be consistent until you feel yourself become calm. And this helps a bunch with mental health.
So, another coping mechanism is physical activity. And physical activity or engaging in physical activity can really help your mental health because it releases endorphins, which can help elevate your mood. And you could do this by taking a walk or riding a bike, doing yoga, or any physical activity that just gets your heart pumping.
Expressive arts. Art therapy is amazing for your mental health. If you don't feel comfortable with sharing with your friends or family, or just don't have that kind of relationship, or don't want to burden them or feel like you're burdening them, art can really help you get those emotions out. This can be in the form of journaling, dance, painting, coloring, writing, music, photography even. Anything that helps you get those emotions out in a healthy way. Mindfulness. Mindfulness is a way to de-stress after a long day, maybe you want to do it in the morning right after you wake up and just get your thoughts in order. Mindfulness is a way to observe on the present, to really go through your thoughts and emotions you're feeling, and maybe learn from those in the future. Things such as how have you affected others? What have your actions done today? How have your emotions affected your actions? How have others affected you? Things like that. In fact, 19.1% of the population, almost 20% of the US population, it has a seriously debilitating anxiety disorder. That's a lot of people. And a good way to deal with that kind of stress and anxiety would be mindfulness. It's a simple activity that you can do without any other supplies. You just sit and relax and think. It's that easy.
Continuing off what Cooper said, we could practice positive self-talk. And you might be asking, what is positive self-talk? Well, it's the constant battle between the negative and the positive thoughts that run through our head at every moment of our lives. And one way you could practice this is by replacing the negative self-talk with the positive self-talk. And this could be an example of reminding yourself of your strengths and capabilities and just like the small things that you did throughout the day, because even the small things can have a huge impact on your mental health.
Establishing routines. Routines give you a sense of control and sustainability within your life. They give you a long-lasting impact if you keep on doing it every single day. That is the main part about routines. You have to do them every day. Some routines that people do that you don't even know is getting up, eating breakfast, just brushing your teeth and combing your hair can give you positive thoughts, you can leave a positive impact within yourself. As what Mia said, positive self-talk, doing that every day is what will leave a long-lasting impact. You can't just say, yay me, I completed my math homework one day. You have to keep going. You have to think about what's happening and making sure that you recognize you did something.
And one routine, continuing off of what Mike said, is to frequently go outside. And this is very beneficial to your mental health because the sun increases your serotonin levels, which can increase your happiness and just your mood. And, it also helps because the sun can release essential vitamin D. And an example of this is like stepping outside into the sun after being in a really chilly building. So don't shy away, soak in the sun's positive energy, and don't forget to wear your sunscreen.
All right, remember, these slides are not only here to help those who are suffering with a mental illness, but they're also just here for anyone. Anyone who maybe is having a bad mental health day and wants to use one of these coping mechanisms to uplift themselves or just feel better about the day. These are just opportunities for growth and options to use at your own free will. Actually, I myself want to grow up and become a lawyer specializing in medical law and ethics. I plan on using these coping mechanisms to help clients who maybe are suffering with a mental illness and are struggling to get through a meeting. I can use these methods to help them calm down, refocus, ground them, and feel better.
Moreover, I want to be a clinical laboratory science, and that job can be very stressful. And because it's so stressful, I can utilize breathing technique and other coping mechanisms to help just elevate my mood and reduce my stress.
Mental health is very big within people who have suffered injuries or incidents. They all go through a dark place. I personally want to be an orthopedic physician, which I know that I will meet a bunch of athletes and people who have got injured and they feel like they've lost something within them. I can use these techniques to help people remember that it's okay. Your mental health comes first before your physical health because you need to be present and you need to be aware of what's happening within your body. And using all of these techniques can also help relieve everything that is going on in your life. References. Everything that you have heard in this presentation has come from all of these websites, the cold hard facts. We also provided a hotline for people who may be suffering with mental illness. You can call or text or chat online, and it is no matter the circumstances, no big or small. It is free, private, and it is confidential. That is the biggest part, confidentiality.
And on behalf of Las Cruces High School HOSA, we thank you.
Remember, mental health is not something that should be hidden from the world.
And as Michael Clifford used to say, it's okay to not be okay.
Also, we have a QR code that you can scan and review how we did presenting and how this presentation possibly helped you. Thank you.
Thank you.
Thank you.